Welcome to the deep dive. You know that moment when a child suddenly starts limping, seemingly out of nowhere? It can be quite alarming.
It really can. And often, the culprit is something called transient synovitis.
Exactly. So today, we're going to unpack that, give you the essentials on transient synovitis, making it easy to understand and remember. This is really for anyone working with kids or parents, too, who need the key facts quickly.
Right. We'll cover what it is, the potential causes, how it looks, clinically, and how it's managed. Basically, the high-yield info.
Perfect. So let's start right there. What is transient synovitis, fundamentally?
Okay, so it's an inflammation of the lining inside the hip joint, the synovium. It's
Yeah.
temporary. That's the key part of the name.
Temporary inflammation. And it's common in kids.
Very common. It's actually one of the most frequent causes of hip pain in young children. And importantly, it almost always gets better by itself. Think of it like a short-lived grumpy phase for the hip joint.
A grumpy hip. I like that. Which kids usually get this? Is there a typical age?
Yes, typically it affects children between, say, 2 and 10 years old, maybe most commonly around 3 to 8, perhaps.
And it often pops up after they've been ill.
That's a very common pattern. Parents might say, oh, they just got over a cold or some other, viral thing. An upper respiratory infection is a classic precursor.
Interesting. So why does that happen? What's the thinking on the cause, the etiology?
Well, the exact trigger isn't always known, to be honest, but the strongest link seems to be that recent viral infection, sometimes even following a vaccination.
Okay.
The idea is that the body's immune system gets triggered by the virus or vaccine and then, maybe mistakenly, causes a bit of inflammation in the hip synovium as a sort of post-infection reaction.
An immune response kind of gone slightly sideways temporarily.
That's a good way to put it, yeah.
Are there any specific risk factors apart from that age group? Boys versus girls, anything like that?
The main thing really is the age, that 3 to 10 bracket. As for gender, no, it seems to affect boys and girls pretty equally.
Okay, so going deeper into the mechanism, the pathophysiology, it's just inflammation in that joint lining.
Essentially, yes. The synovial membrane gets inflamed. That immune response we talked about leads to the release of inflammatory mediators chemicals, basically within the joint. That causes the pain and sometimes a bit of fluid buildup.
Right. Now, this is important. A child comes in with hip pain and a limp. Transient synovitis is common, but what else must you think about? The differential diagnoses.
Absolutely crucial. The number one thing you have to rule out is septic arthritis. That's a bacterial infection in the joint, and it's a medical emergency. Needs urgent treatment to prevent damage.
Okay, septic arthritis is top of the list. What else?
You'd also consider things like Perthes disease that affects the blood supply to the head of the femur, maybe a fracture, though often there's a history of injury there, and in some cases, maybe early signs of juvenile idiopathic arthritis, JIA.
A few serious things to keep in mind.
Definitely. You need to be thorough.
How common is transient synovitis, really, epidemiology-wise?
Specific numbers for the UK aren't that well documented, surprisingly, but it's widely accepted as the most common cause of acute hip pain in children. So despite the lack of hard stats, clinicians see it a lot.
Got it. Most common cause. So what are the classic signs, the clinical features?
The textbook presentation is sudden onset hip pain. This makes the child limp, or sometimes they just refuse to bear weight on that leg altogether.
Okay, sudden pain, limp. Anything else?
You might notice they hold their legs slightly turned outwards and flexed at the hip. It's often more comfortable that way. Maybe some tenderness if you examine the hip. But, and this is really key,
Yes.
fever is usually absent, or if present, it's very mild, low grade.
Ah, right. You mentioned septic arthritis having a high fever.
Exactly. A child with septic arthritis is typically quite unwell, systemically unwell, often with a high fever. With transient synovitis, they might be miserable because of the pain, but they don't usually seem sick in that infectious way, and the temperature is normal or only slightly up. That's a huge clue.
Low or no fever. That's a critical point. So what tests might you do to help confirm or rule things out?
Usually, you'd start with some basic blood tests, things like a full blood count, ESR, CRP. These help look for signs of significant inflammation or infection, which you'd expect to be higher in septic arthritis.
Right. Check the inflammation markers.
Yes. And then imaging might be considered. An X-ray is often done mainly to rule out bone problems like a fracture or Perthes disease, though it's usually normal in transient synovitis.
Oh, an ultrasound.
Ultrasound can be very helpful. It can detect fluid in the hip joint and effusion, which supports the diagnosis of synovitis. It can also help guide aspiration if you were really worried about septic arthritis, though that's less common if the picture strongly suggests transient synovitis.
Okay, so you've diagnosed it. How do you treat it? What's the management plan?
It's mainly about supportive care. The focus is on relieving the symptoms while the inflammation settles down on its own.
So things like,
Rest is important, reducing weight bearing on the affected hip. Pain relief is key. Simple analgesics like ibuprofen, which also has anti-inflammatory effects, or paracetamol.
ibuprofen's often good then for the inflammation too.
It often is, yes. And sometimes, especially if the pain is bad, crutches might be recommended for a short period to help them get around without putting weight on the hip. You could think of it as RITA, perhaps? Rest, ibuprofen, paracetamol, activity modification.
IB rest, ibuprofen, paracetamol, activity modification.
Nice. And what's the usual outcome, the prognosis?
Generally, it's excellent. It really is self-limiting. Most kids start feeling much better within a few days, and it usually resolves completely within 1 to 2 weeks.
That's really reassuring.
It is. Long-term problems are very rare.
Are there any potential complications, even if rare?
Complications are uncommon, but it can sometimes recur, so they might get another episode later on. Persistent pain is possible, though not typical. And very, very rarely there's been a suggested link with developing leg Calvi-Perthes disease later, but that's quite tenuous. Okay, so follow-up is probably a good idea.
Yes, often a follow-up check is advised just to make sure everything is settled completely and there are no lingering issues or signs of anything else.
Great. So let's wrap that up. Transient synovitis, common cause of hip pain and limp in young kids, often follows a virus, that grumpy hip idea. Key feature, low or no fever, distinguishing it from septic arthritis.
Precisely. And management is supportive rest, pain relief like ibuprofen. Prognosis is excellent.
Remember IV rest, ibuprofen, paracetamol, activity modification. It's common, but always keep those differentials, especially septic arthritis, in mind.
Absolutely. Understanding this common condition is key, but so is knowing when to worry about something more serious.
Definitely builds confidence in managing these pediatric cases.
Well, that was a fantastic overview. And for everyone listening, if you're revising for your exams, don't forget to check out passthemsra.com and freemsra.com for more resources.
Great resources there. Thanks for tuning into this deep dive.